Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Today is Monday, a fresh start to the new week, and we are discussing the listening session. So I'm just trying to record a listening for you and to tell you what to do when the listening part C is there, because you know that you won't have any extra time in the listening part C. So you have to be really specific about it. So listening part C, the first thing that you will get is around 90 seconds. In the 90 seconds, in the first 90 seconds, you need to read only the questions. So what are the questions? So in 90 seconds, they will give you 90 seconds before they start. 31 to 36 question, there will be 6 question. Then there would be another extract of 6 question. So you need to read 6 question, 31 to 36. What Sandra Morton see main aim in her work? So the main word I would like to notice is there, what is her main work? So I will underline this word in my listening exam. Let me do it for you in front of you. So suppose this is my exam. So I'm doing this listening. What is the main aim? So I will do. This is the only word, main aim. When Harry was offered a routine health checkup at his local surgery, he initially, this word is very important. So he initially resisted the idea, means what did he feel? So if I can read, he felt, he agreed. So that means how did he react initially? So that is again the second main focus. So the first is Sandra Morton main work. What is she? Second is that he initially, what did he do initially? During Harry's investigation at the hospital, he. So again, that is another reaction that you would have to see. Then you go to the next 3 questions. What was Harry's response to being diagnosed with the prostate cancer? So my main thing is, when the prostate cancer was told to him, what was his response? So earlier there was an initial response to the routine surgery checkup, and now they are talking about response to the diagnosis of prostate cancer. So basically I can make a picture, I can make a story that basically Sandra Morton would be a nurse, maybe a cancer nurse. Then second thing, I can understand that Harry was not having any symptoms, but he went to clinic for the normal routine checkup. So his initial reaction, what was his initial reaction? That's my second question. Third question is, during the investigation, what happened? Fourth question is, he was diagnosed with cancer. So I can frame the story that he was maybe not interested in going. Then he went for the checkup. Ultimately, he was diagnosed with the cancer. So I think he should be at shock. He should be at shock. He found reacting in the way he was unconvinced. He immediately researched. Maybe he will be searching for the treatment, but don't read the options. Just try to know the story in the start. What typical patient response to illness does Sandra mention? What is the typical response of the patient? That's the fifth question. Six, Sandra believes that community follow-up clinics are important because. Now the sixth question is, why are the follow-up clinics important? So it will take around 30 seconds or so out of the 90, or maybe if you are a slow reader, will take around 40 to 50 seconds. But you should be able to make a story. First, Sandra Morton, what is her main work? Second, initial reaction. Third, he, I don't know, that is also a reaction question. Fourth, response to diagnosed with cancer. Fifth, I forgot thing, typical patient response. And sixth, the last question is, why are community follow-up health clinics important? So at least you should know, you should not remember these questions by heart, but at least you should understand the story in the first 40 seconds. Now I understand the topic. The topic would be of prostate cancer. Initially, he might not be interested. So I can understand few things when I know the story. So then you start playing the list. By the time you would be reading all these 6 questions, 5 or 10 seconds you will get to read these first options. So now you are ready for the first question. So you want to read first question. What is her main work? To inform the patients about the different treatment, to publicize the test, or to raise the awareness of the symptoms. Now I will try to notice 3 keywords out of this: treatment, test, or symptoms. What is her main work? Symptoms, treatment, or test? Let's see what is her main work. So I will record it for you.
Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many.
So the main thing is people like me. So now she's talking about her main work.
In men in the UK with over 40,000. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating.
So my job is to spread the word out how to spot, how to recognize this illness, and urinating and all those things are the symptoms. So her main work is to raise awareness of the symptoms. She is not talking about any test. She is not talking about any treatment. So an easy question to do if you understand just 3 words: treatment, test, or symptoms. So she's talking.
Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So
the treatment option, she has just said that most people come in the advanced stage, so treatments are less effective. But she did not talk about different treatment options. She did not talk about different treatment. She just said the word treatment, that treatment options are not there because they come in the advanced stage. So again, my answer becomes C, that she wants to raise awareness of the symptoms. So again, how to find it? What is the main work? Symptoms, treatment, or test? So she is saying when the people come late, they do not have the treatment options. Whereas the options A says that's to inform the patients about the different treatment options, but there are no options. She's saying there is no treatment available because they come at late stage. I will play it again for you.
prostate cancer, like an increased need to urinate or straining while urinating.
So these are the symptoms.
Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective.
So treatment are far less effective. So she does not have any option to give. So she does not have various kind of treatment options. So that is how you rule out option A. She did not talk about any test. The only answer could be C. So that is how you find the answer. Let's go to the second one.
So let me tell you a bit more about my patient, Harry.
Now my major word to focus is initially, that how he reacted initially maybe.
Like many middle-aged men, Harry was offered a routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation.
So now she's saying that he almost ignored the invitation. So if I say he resisted the idea due to his wives, he felt that he was too fit and well to be in need of it. So he was too fit and well to be in need of it. That means he considers that he is too fit, he's too well. That means he is having no health problem, and that is why he ignored it. So ignored it means that he felt that he was too means too much, that he was too fit, he was too well to be in need of it. That means he does not need it. He was too well. Like if I say you are too good, so I want to say you are too good means you are very good. But if I say you are too smart to pass, then I am not saying you are very smart. Then I am trying to be sarcastic. Sarcastic means I want to pass a tone. You are too smart to pass. That means I'm not saying you are very smart. I'm saying you cannot pass. If I say you are too intelligent to become an IAS officer, so means I'm saying you are too intelligent means you are more than required. So means I don't want to say that you are intelligent. So here too word means he initially felt that he was too fit and too well. In this case is like he was too fit and too well. So according to him, he was too fit. He was over here. Too means very. So you don't have to go into that sarcastic mode. Over here, he felt that he was too fit, means he was very fit and well to be in need of it. That means he does not need it. That he was very good. He was very satisfied with himself. That is why he ignored. So these are the words you need to match when he said that he ignored. Please
On
listen to
stage
that
by the
again.
time patients come in for tests,
Let's listen to
at
it
which
again.
point the available treatments are far less effective.
Let's see.
So, let me tell you a bit more about my patient Harry. Like many middle-aged men, Harry was offered a routine health check at his
So these are the keywords. Routine health checkup. That is where you start focusing on the line. These are my keywords.
doctor's surgery. As far as he was concerned, he had no particular health problems or obvious
He had no health problems.
symptoms at the time, and so he almost ignored the invitation.
So he ignored. So he felt that I'm too good, yaar. I don't need it. I'm too good to be in need of it. I'm too good to be in need of it. I don't need it. So means too good here means I'm too good to be in need of it. That means I don't need it. So that is what is the meaning.
But he'd promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go.
So that means due to his wife's experience, he felt obliged. That means he went due to his wife. So he resisted the idea due to his wife. No, this is opposite. He did not resist the idea. Rather, he accepted the idea of having a routine checkup just due to his wife's experience. So he did not resist the idea. He accepted the idea because of his wife's experience. Let's listen to it again.
But he'd promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go.
So his wife had a cancer. So due to his wife experience, he felt obliged to go. So he did not resist the idea. And A option says he initially resisted the idea. No, he rather went to the clinic just because his wife had that thing. So due to his wife experience, he went over there. Now the third question.
It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital. Harry's trip to the clinic started with a routine blood test, which initially
Now I focus on the blood test option. That started with the blood test.
showed a slightly low hemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20.
So his PSA was high. His hemoglobin was low. That means his primary blood test was not good. Whereas the option is saying, C is saying, he was given false hope. Hope means a positive thing happened. But she's saying that in the preliminary test, no hope was given. Rather, it was negative report because his PSA antigen was 20. His hemoglobin was low. That means preliminary blood test did not give any hope. It was a negative test. Whereas this is C option is saying it gave hope to the patient. So this option is sounding positive that it gave false hope. Whereas actually in reality, the preliminary test was negative. His PSA prostate serum antigen came out to be 20. So there was no hope. Rather, he got negative. So please understand this hope word. Hope word is a positive word. Whereas preliminary blood test negative happened that his PSA was positive. Let's see more.
He then saw a urology consultant who conducted a digital rectal examination and biopsy. A procedure that I always try to explain to patients may be uncomfortable, but
so now you understand the most important thing when you do the listening. Please listen to this video 10 times, guys. Till the time you do not understand this video, keep listening to this video and please subscribe our channel if you have not. But and also please, this recording is very must to understand how do they play with you. Now she is saying that I always tell my patient that the procedure may be unpleasant. Whereas question, if you read the question, during Harry's investigation for the prostate cancer at a hospital clinic, he felt part of the examination procedure was unpleasant. That means Harry felt it. That means it is a fact that Harry felt it. Whereas she is saying, I normally tell my patient that it may be unpleasant. Maybe means it's a probability. Whereas he felt means it actually happened. So in paragraph, speaking, she is saying it might be unpleasant. That means it may be, it may not be, depending upon the patient. Whereas A option is saying Harry actually felt unpleasant. So these two things are not matching. May word is also not matching. Harry did not feel anything. We are not talking about any. It's just she is saying that it can be little unpleasant. Let me redo it for you.
The prostate-specific antigen was high at 20. He then saw a urology consultant who conducted a digital rectal examination and biopsy, a procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary.
So now you can understand how hard this third question is, because she talked about preliminary blood test. Then you can say false hope means maybe wrong, but there was no false hope. It was not a positive sense, so there was no hope. It was rather, he felt hopeless. Second, when she talked about the examination, she is saying it might be unpleasant. I normally tell my patient, but he felt that it was unpleasant. She did not say. So they play up with you, and that is why listening sometimes become confusing. If you notice the word, the right connectors, and please listen to this recording again and again. Whatever the points I am speaking, like it was easy, the first question, because treatment, test, or symptoms. Second was little bit confusing as two options were there. He was too fit, so he ignored it. Only word anyhow goes for elimination. Resisted the idea due to wife? No, he accepted the idea. So again, this is a contradictory option, could have been eliminated. In this question, two options are very close, but they both are contradictory because hope word is a positive word, but test was negative. And he felt that no, he did not feel anything. This is grammar. So you have to eliminate. It might be unpleasant. No. He felt that he did not feel anything. There was nothing, whether he felt good or bad about the rectal examination has not been talked about. Let us
examination and biopsy. A procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal.
So he rather found it hard to wait for the biopsy taken and 3 weeks for the reports to come. That is where he found it difficult. So he found it hard to cope up with the wait for some result. And how much did he had to wait for? 3 weeks for his biopsy report. So that is what he found to be hard. Now listen to again the last line.
Try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal.
Outcome means result, conclusion. That is why I say, if your OET reading is good, your OET listening would be good, because result means outcome. Outcome means conclusion. So the word result will be always be replaced by outcome, finding, or conclusion. Outcome, finding, or conclusion. So he rather had to wait 3 weeks for the result. That was the ordeal. ORDEAL. Ordeal means problems. So that was the problem he faced. Ordeal is a negative word. If by chance you listen to it again, ordeal. So ordeal is a kind of a negative thing. So this is a common English word that you can remember. Now let's try one or two more questions.
Harry told me that when he went to see the
Now I want to know about the Harry's response to being diagnosed with the prostate cancer. So what is the Harry response?
To get his results, he immediately sensed he was in trouble. Although the consultant was very...
So he immediately sensed that he was in trouble. That means he could sense it, that he was in trouble. That means as soon as he entered, he could realize something is wrong. He was unconvinced by the prognosis. He found reacting in the way he had not anticipated. He immediately searched. So this immediately word is very important. Again, words like only, always, everyone, initially, immediately. So these words are the easy words to eliminate. Like he immediately researched. Let's see whether he immediately researched or not. Let's listen to it again.
More of an ordeal. Harry told me that when he went to see the consultant to get his results, he immediately sensed he was in trouble.
He immediately sensed he is in trouble. So immediately is not used with the word research treatment options. So C anyhow is eliminated because somehow they have not talked about the treatment options with the immediately word. Immediately word she has used was he immediately sensed. So C option might be eliminated, might be. Let's see more.
Although the consultant was very considerate in delivering the news, unfortunately, the indications were that Harry did indeed have prostate cancer. He was assured that the cancer was low grade and not aggressive. Harry had suspected the worst, and though he tried to prepare himself for it by doing some online research, finally hearing that confirmation was still a shock.
So he researched over the internet and he was prepared for it. But still he was in shock. That means he found reacting in the way he had not anticipated because he was prepared. So he should not be in shock. But after listening to it, he did not anticipate that he would be reacting this way. He would be in shock. So let's listen to this again.
Tried to prepare himself for it by doing some online research, finally hearing that
the online research word, she never talked immediately. So these are the easy options to eliminate by catching the words like immediately. All these words are very important. So it will help you in easy elimination.
Low grade and not aggressive. Harry had suspected the worst, and though he tried to prepare himself for it,
he suspected the worst. He tried to prepare for it. So that means he was anticipating negative thing, and he suspected the worst means he was suspecting more than the real thing. Worse means he thought even bad. Worse means he is bad, he is worse. Means he is more bad. So he suspected the worst. He was suspecting more bad. But still, he could not really accept that thing.
Doing some online research, finally hearing that confirmation was still a shock.
Was still a shock. Still was shock for him.
In fact, the very mention of the word sent Harry into panic.
Rather he went into panic. Now it is 100% A that he did not anticipate that he will go in panic, but he ultimately went into panic.
It's very unlike him. So at the time
which was very unlike him. Now this is the perfect word. Which was very unlike him means that he had not anticipated. It was very much unlike him. Unlike means not the same what he anticipated. I am like myself. Today, I am not like myself. Today, I am unlike myself. Means I am not what I am normally. I am unlike myself today. So unlike means I am not the same what I am usually. So which was very unlike him. That means he did not anticipate he would react this way.
Met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can.
Now she's talking about normal patients like Harry, what other patients do. An unwillingness to complete medication, a failure to seek advice regarding different treatment options, a reluctant to talk about the embarrassing aspects. Now, three things. I just need to find whether people are reluctant to talk, whether they are reluctant to take advice, whether they do not want to complete medication. Now, three things: medication, advice, or embarrassing. Three important words. Let's see.
Time I first met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example.
Vary enormously means everybody can react in a different way. Everybody can react in a different way, but I have to find a typical response. Typical means major of the time, most of the times, what is the response? Typical means to of a particular type. Typical means certain. Typical, he is having his typical way of teaching. He is having his specific way of teaching. He is having his certain way of teaching. He is having peculiar. So word like peculiar, typical, particular, specific, these are the same. Peculiar is a very important word. Peculiar. Peculiar means particular, specific, certain, typical. All these words are always same. So please try to remember this too. Let's listen to it again.
Cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately,
so basically, most of the patients, they do not take medications because of no symptoms. And especially, they do not take medication because of the side effects. That means because of the side effects of the medication. So that means normally people do not take medication because of the side effects of the medication. That means they have an embarrassing aspect of the treatment. This line is there for sure. Embarrassing aspect means side effect of the treatment. But are they reluctant to talk about it or not? That we have to see. If they are reluctant to talk, then my answer becomes C. Otherwise A, that they are unwilling to take the medication. Let's see.
I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt
Keeping up means following up. Following up means keeping up means to maintain. So maintain means they do not complete the medication. So keeping up word is also important. Let's see.
well, especially if they've been. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bone.
So she did not talk about anything, whether they are reluctant to talk about adverse effects or not, or they are interested to talk about. So this word is missing a reluctant to talk. So now she is saying that most of the people do not complete or keep up their medication,
making it much more difficult to treat and a successful outcome less likely.
so the successful outcome or the successful result is unlikely because people do not keep up with their medication.
Treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing.
But now this is confusing. Now she is saying that it has some aspects like erectile dysfunction, which some men are reluctant to share. So now C and A. Now this becomes the toughest question of this listening until now. Otherwise, this listening was going perfectly fine until now. This is the toughest question. Now don't worry about this question. Whether you do A or you do C, leave it upon luck. Don't overthink about it. You can't do all the questions right. This is the most important thing you can learn from listening. You can't do all the questions right. Please understand. So now this is confusing me. A or C?
Well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bones, making it much more difficult to treat and a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing.
Now I have found the word. It should be A only. The reason is some men. Some men means very few men. And some experience side effects. So means those people are also less. So typical patient response, I think typical means typical should be like more majority. Typical should be majority like. So A should be the answer rather than C. But I don't know in what sense he has used typical. So again, I'm confused. But majorly what I think typical means what are your typical methods. So I will be talking about common methods. And she said that some have erectile and out of them, some do not talk. So that means these people are very less. So it is not a typical patient response. Typical means common, often. And she's saying some word in the C option. So I'm eliminating the C option from my side. Let's listen to it again, the last.
And a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing.
Some men. So it should not be typical patient response. So eliminating C option, again coming back to A. So which I was getting confused. If I could have listened to it for the first time, then this question was also doable. But I should know what typical means. But again, if my one question would be wrong, I don't have issues. Because I'm confident about the rest of the 4 questions. Let's see at the end what will happen.
Because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and cons of the various treatment options they're offered. From
other means the rest of the people. Other means rest of the people, they do not know what is the pros and cons. Pros and cons means benefits and drawbacks of the treatment options. So
sound or radiotherapy, because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and
they have been given a lot of help. That means help has already been provided to them. So we cannot say they have the failure to seek advice. They have already got the help. They have already got the advice about different options. So it is not the failure to seek advice. They are just confused.
cons of the various treatment options they're offered, from ultrasound or radiotherapy right through to radical prostatectomy, because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help,
even they have been given help, that means they have been given the advices. So they have sought the advices. They have already taken. So there is no failure to seek advice.
Still difficult to weigh up the pros and cons of the various treatment options they're offered, from ultrasound or...
Now this is a typical question, because B also can confuse you, because they are talking about different treatment options, but there is no failure to seek advice, because the advice has already been taken. Reluctant to talk, there is no some people have reluctance, but this is the difficult question that I can guarantee. And in this kind of a question, you should not worry in the exam.
Therapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of health.
So now, why are community follow-up clinic important? Now she's talking about community follow-up care after the treatment options. So she was talking about the treatment options. Now she has come to the follow-up clinics. Let's see what it is.
Or radiotherapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinic.
Now, by the time she's speaking, I have noticed 3 words: rapid treatment, less traumatic, or personal care. Means follow-up clinic, personal care, fast treatment. Rapid means fast. Personal care, fast treatment, or less traumatic. Let's see. 3 words: less traumatic, fast, or personal aftercare.
We have in my area, which address many of these issues in the provision of healthcare for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms.
So follow-up clinics, patients are provided follow-up, and these are sent to the hospital only if they develop new symptoms. Otherwise, they provide follow-up care.
Seeing patients in the clinics means that staff get to know each patient and build a...
So that means C option is out, because follow-up clinics do not provide treatment if new symptoms are developed. If new symptoms are developed, these follow-up clinics send the patient back to hospital. They do not provide any treatment. Rapid is a word too far. They do not. Follow-up clinics are important because they provide rapid treatment? No. Sandra believes that community follow-up clinics are important because they provide rapid treatment. They do not provide treatment. They just provide follow-up care. If there would be any new symptom, they will send the patient to hospital. Listen to it again.
which address many of these issues in the provision of healthcare for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms.
Significant new symptoms sent to the hospital. They do not provide treatment.
Seeing patients in the clinics means that staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions.
So they develop a relation, personal relation, in a way they know each other well.
Although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
So they provide less care. So now I am almost done. Thank you for your patient hearing. Please subscribe the channel if you have not, for your own good, not for me. And now talking to you all. How was the session? And please let me know about the answer. First three answers we checked already. So B, first three answers C, B, B. That's what we did, right? First three answer, guys.
C, B, B.
Okay, and now the next three which we have to check. So you can let me know about the last three options, please. What are the last three?
34, sir, A. 35,
34,
C.
34th A, we did A as well, na?
Yes, sir.
Done. 35th?
35th, sir, C.
35.
Okay, C. Maybe because I was not sure. I told you that I was not complete because some means sometimes some means specific, some typical as well. So it can be. So 35th, I took the risk. I know. I was not sure. Anyhow, 36th.
A, sir.
हाँ ये ठीक है. So मतलब means we have got 34th right, 36th right. It's only 35th which is wrong, right? 35th is the
Yes,
only
sir.
one that is wrong, right?
Yes, sir.
So that's fine. I can afford it. So thanks to this wonderful people who has created this question paper. And but yeah, it's just about learning. You can do various. Still want to check 35th. Reluctant. So some means again some would have been taken like certain specific people. So it can be, but one question I can afford for sure, and I don't want to do all the questions right anyhow. One would be wrong, obviously. The rest of the six questions, five questions are right, which is more than enough to get more than 400. So please focus on the easy questions. Don't fall for questions like 35th, even in the reading, because she told that most of the people are unable to cope up with the medications. So that could have been the answer. And I don't know why it is not the answer, but I don't want to over confuse. When I know rest of the listening is good, why do I want to over confuse myself? Again, I have told you, listening and reading is all about doing easy questions right and not to overthink. So this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256 for the best OET coaching, and subscribe our channel if you have not. Please listen to this video 10 times. Thank you very much.